guys. So welcome to the back pain series. And now, so basically, this is going to consist of two main types of pain, the upper back and the lower back pain. And this will be further subdivided, and each condition is going to be taken care of. So, if you're already diagnosed and you know what you are suffering from, it is just going to help you, and you can concentrate on that video and the exercises shown in that video, and you can just continue doing that at home. Also, we are going to have with us Dr. Pamela D'silva, and she is going to help us understand the problem, understand the pain that you are suffering from, differentiate between the pain and a pain, and thus she's going to tell us the main exercises that you should be doing, and I'm going to demonstrate that for you, and you can do it at your home.
Lumbar spondylosis is one of the most commonly diagnosed conditions of low back pain. Now, this condition is a slowly progressive, irreversible degeneration of the lumbar spine, which presents with a range of painful symptoms and limitation of activities of daily living. This condition can be seen in the age group of as early as 20 years, and it is a more common diagnosis as one's age progresses. Now, there are various risk factors for this condition, such as aging, then previous history of trauma to the spine, obesity, mechanical stresses on the spine due to occupation, such as occupations which have a lot of twisting or bending activities, and poor posture. Now, these various risk factors which I've mentioned, they cause a lot of mechanical stress on your low back spine. And what happens is there is a protective layer known as the articular cartilage, which allows for the smooth movement of the spine. This articular cartilage gets worn off, and as a result, there is decrease in the amount of joint space between your lumbar vertebrae. Now, in order to manage this condition, there are various exercises which have to be done. Now, before going in for the exercises, I will tell you all three presentations of this condition. And if all of these are positive, and if you are in the later age group, then it is likely that you have lumbar spondylosis. Now, the first presentation is pain in the center of the low back region. The second presentation is tingling or numbness along the lower limb or your leg, along with sharp shooting pain down the leg. And the third very common presentation of this condition is when you have difficulty in moving the spine or difficulty in getting out of bed, which is a very common complaint. And for the early 30 to 45 minutes of the day, you will have difficulty in doing any activity of the low back. These are the presentations of the lumbar spondylosis condition. Now, like I said, in order to manage this condition, since it is an irreversible condition, one has to perform exercises which can be categorized into two. The first form of exercises is known as the lumbar mobility exercises. Now, these exercises are important in order to regain the lost mobility so that you can perform your activities easily. And the second form of exercises is known as the lumbar stability or strengthening exercises. Now, this set of exercises is very important because improving the strength of the muscles around the back region is going to decrease the amount of stress which falls on the entire spine during your aging process. So, in order to combat this or to slow the progression of the condition, this strengthening exercise is very important. Now, in your lumbar mobility exercises, you have two main exercises. One is the lumbar trunk rotations, and the second one is lion stretch. And in your stability or strengthening exercises, you have three exercises. The first one is known as a pillow push. The second one is known as the bridging exercise, and the third is the modified side plank. All of these exercises will be demonstrated in a while, and the precautions which you can take to decrease the progress of this condition is maintain an active lifestyle and Also, try to maintain good posture in sitting, standing, and while performing activities.
So I'm going to demonstrate the exercises that were mentioned. We're going to start with the lion stretch. So please ये position में बैठिए. All you have to do is पहले इधर आइए जैसे एक बच्चा walk करता है चार पाँव पे वैसे, and your hands are exactly in line with your shoulders, not ahead or not behind. And then you just have to go down, down, down. So you are going to feel the stretch here and in your shoulders here also. And then you can stretch out your shoulders more. And after this, again, just come up and repeat the same exercise. This is going to be the trunk rotation exercise. उसके लिए आप ऐसे लेट जाइए, अपने दोनों हाथों को अपने साइड पे रखना है रिलैक्स्ड, एंड फिर अपने पैरों को उठाना है. ये 90 डिग्रीज या ये ऐसे ही रह सकता है, but this has to be straight from the ground, and then you just have to rotate your lower limbs, and this is in turn going to rotate your back, especially your lower back. Please make sure कि इसमें आप बहुत इधर उधर नहीं जा रहे हैं. Your back has to be on the ground and just your lower limbs need to move. The next exercise is bridging, and I'm sure ये बहुत सारे videos में आपने देखा होगा. ये position में आ जाओ, your hands on your side, relaxed, and you just have to take your pelvis up. Hold it here for 10 seconds and then slowly get it down. झटके से मत लाना, or you just cause more pain. We're going to do the modified side plank. सिर्फ प्लैंक करने के टाइम हम एक्चुअली ये करते हैं, एंड दिस मेनली वर्क्स ऑन योर कोर. इट डज नॉट इंक्लूड योर बैक दैट मच. In the modified side plank, it's easier, and also it will hold your, it will help your abdominals, your obliques, and your gluteal muscles and your back as well. तो आपको क्या करना है, आपका एल्बो ऐसे नीचे रहेगा 90-90 पे. Your lower leg जो नीचे की तरफ है वो ऐसे bent रहेगा, and ये वाला ऊपर. And all you need to do is take your hip up यहाँ पे. तो here you will feel a pressure while doing this, and over here, and then back. And you have to continuously do this. Hold it for 10 seconds, then come down again. The next exercise is known as the ball push. But हर एक के घर पे शायद ये gym ball available नहीं होगा. If you have it, well and good. If you don't, then obviously you can use 2-3 pillows and then do the exercise. So all you have to do is lie down in this position and keep the ball against your thigh. And with the help of your palm, you have to just give a slight pressure, and you need to push the ball towards your thigh. The pressure should not come from your thigh to the ball. Please remember that. All you have to do is this. With this, it's very important for you to continue your breathing exercise, and this will help you activate your abdominal muscles. अगर आपके पास एक बॉल नहीं है तो आप 3-4 पिलोज यहाँ पे रख के सेम चीज़ कर सकते हैं. अपने हाथों से जेंटल पुश देना है. दैट्स इट. प्लीज रिमेंबर टू ब्रीथ. Next we're going to do the Superman exercise. This is a very common exercise, so I don't need to explain much in this. Please be in the quadruped position, and आपका opposite hand and leg move होगा. Do it for 10 times, and then you can repeat it on the other side. Also, I would like to clear out a misconception. हमेशा बहुत लोगों को मैंने देखा है जो बिलीव करते हैं कि अगर आप बैक पेन से सफ़र कर रहे हो, देन यू नो इट्स बेटर टू जस्ट रेस्ट फॉर अ वाइल एंड कम थोड़ा बेंडिंग या ये सब करे ताकि बैक थोड़ा पेन एग्रीवेट नहीं हो. बट रियली आई विल नॉट रिकमेंड यू टू डू दैट. It's very important for your body to be active, so get moving even if you have the pain. Please, there's no pain, no gain, right? So please just do it, do all the exercises. Also remember, before every exercise that is shown in any video, you have to make sure that you are stretching your body very well. All your muscles need to be stretched out so that they are all relaxed and ready to be activated, and strengthened. So please remember that. Also, you can do it before and after the exercises. That's just on you. And अगर आप hot moist pack भी लगा सकते हैं, then please do that because it's going to add on to your relaxation. You remember all the exercises. I would like to clear out one thing, that these are not the only exercises that you need to do. These are a few main exercises that are needed. Also, if you have already been prescribed with a few more other exercises, please be free and feel free to do that. एक और बात, you should be very selective about the things that you are doing. As I mentioned that it's very important for you to stay active. That doesn't mean कि आप excessive कोई activity कर ले जिसकी वजह से load increase हो रहा है आपके back पे. So एक simple सी चीज़ भी, अगर आप घर के जो काम कर रहे हैं एंड उसमें अगर आप बर्तन भी धो रहे हो, दैट इज़ गोइंग टू इंक्रीज अ लॉट ऑफ लोड बिकॉज यू आर कॉन्स्टेंटली इन वन पोजिशन एंड वन पॉस्चर एंड यू आर वॉशिंग द यूटेंसिल्स. सो आपने बहुत बार नोटिस किया होगा कि आप बर्तन धोने के बाद एक्सेसिव पेन हो जाता है. So yeah, so you need to figure out the activities that you should not do that will just increase the load on your spine, but that does not mean that you do not do anything. So please be very selective, and as I always say, relieve your pain and regain your life.